Hello everyone, this is Sarita Sharma and welcome to my Journal Club 2. And today I'll be talking about this clinical trial of the effects of dietary patterns on blood pressure. And yeah, let's move on. So, for background, the recent data suggests that about 24% of US adults, which makes about 43 million people, have hypertension, and only 47% have optimal blood pressure. And the optimal blood pressure is considered as 120 mmHg systolic blood pressure and 80 mmHg as diastolic blood pressure. Also, adults who are 50 years of age or older, they have higher prevalence of hypertension and and a lower proportion have optimal blood pressure. Then the current national guidelines recommend weight control, reduced intake of sodium chloride, reduced alcohol consumption, and possibly increased dietary potassium as nutritional approaches to prevent and treat hypertension. Then this is also a general understanding that vegetarians tend to have lower blood pressure than non-vegetarians, and some studies have proved that fact. And it can be because of higher fiber content, higher mineral content, and lower fat content of vegetarian diets compared to non-vegetarians. And in some observational studies, a significant inverse association of blood pressure with intake of magnesium, potassium, calcium, fiber, and protein have also been reported. However, still there are some inconsistencies in trials. So, it is known that obesity, sodium intake, and alcohol consumption influence blood pressure. And in this clinical trial, the dietary approaches to stop hypertension, or we can say the effect of dietary patterns on blood pressure, is assessed. So the methods utilized were that in this study there were, as I said, it was a clinical trial. So 459 adults, all adults who were greater than 22 years of age, and the blood pressure criteria was 80 to 90 mmHg diastolic and less than 160 mg systolic. They were enrolled, and also participants were not on antihypertensive. Additionally, people who were on antihypertensives were also enrolled if they were able to get off medication after following some intervention. And then this trial was conducted in 3 phases. So for 3 weeks, the subjects were fed a controlled diet. So this was the run-in phase, and all the blood pressure measurements were taken. And the control diet was low in fruits and vegetables and dairy products with a fat content typical of the average diet in United States. Then, after the initial 3 weeks of run-in phase, participants were then randomly assigned to 8 weeks of the control diet rich in fruits and vegetables, and a combination diet. So, so these three diets were compared. The control diet, which was low in fruits and vegetables and a fat content typical of the average diet in United States. Then the second intervention was the diet, which was rich in fruits and vegetables. And the third one was a combination diet, where the diet was rich in fruits and vegetables and low-fat dairy products and with reduced saturated and total fat. Also, the sodium intake and body weight were maintained at constant levels throughout the trial. So, here let's talk about the results of this study. So this table actually shows the comparison of mean changes in blood pressure between all the diets. And um, so here, the first column is about the mean change between the combination group and the control group. And here, uh, the result was most significantly different, which means that the participants they benefited the most with the combination diet. And also of note, the p-value for this trial was 0.025, which was considered to indicate statistical significant benefit. And this second column shows the mean difference between the combination group and just fruit and vegetable group. So some of the results were significant, some were not. And then this third column showed the mean difference between the fruit and vegetable group and the control group. And similar to the second column, here also the results were not significantly different among all the participants and all the groups. So in this column, see the results were statistically significant for most, most, yeah, I think here just 0.04 value is seen in non-minority, but other than that, all the categories are significantly significant. Then there's this another table shown for results that the first one is for controlled diet, the second line is for fruits and vegetable diet, and this one is for the combination diet. And here you can see this one shows the diastolic blood pressure change, and this one the upper value shows the systolic blood pressure change. And in both the systolic and diastolic blood pressures, the most drop is seen in the combination diet group. So as you can see here as well. So this study concluded that a diet rich in fruits and vegetables and low-fat dairy products with the reduced saturated and total fat, in other words, you can say a combination diet proved to be more effective in lowering systolic as well as diastolic blood pressure among adults, and which means that the results of this study can be applicable to the general population. So this is the study conclusion. There were some limitations in the study that so that some aspect of fruit and vegetable diet. So when I talked about that second column, there were some values which were statistically significant and some values were not. So there were some changes or some benefit was seen with just fruit and vegetables diet. And then the additional aspect of the combination diet, like low-fat dairy and then reduced saturated fat and overall fat, produced some additional benefits. However, this trial did not take that into account, means that the trial was not designed to identify effective and non-effective component of the food. But overall, the study design was good. The study included the demographically heterogeneous population. There were about 40%, like 49% were women, 40% US adults, 60% were Black, and 37% had household income of less than 30,000 per year. So looking at the heterogeneity of the population here, and the results where they showed a statistically significant improvement in the blood pressure with fruits and vegetable consumption and also with the combination diet, I would say that, yeah, I think the results of this study can be applied to general population or my patient population. So, yeah, I think, and moreover, fruits like they, in this study, they included fruits and vegetables, like all the foods or low fat dairy, like all the foods are the normal healthy food items that we include on our day-to-day life. So nothing exotic was suggested. So I think that it makes sense, and definitely my patient population will benefit from increased fruit and vegetable consumption, low fat dairy consumption, and a like a lower saturated fat and overall lower fat diet.